era in injectable boosters focus on Cellbooster Lift. Saya, Dr. Felisa dari PT Samtek Indonesia yang akan menjadi moderator pada kegiatan hari ini. Saya akan memperkenalkan speaker kita, Dr. Timur Taskesen, MD, PhD, Dermatologist. Good evening, doctors, and welcome to the webinar, Cellbooster, a new era in injectable boosters, focus on Cellbooster Lift. My name is Dr. Felisa from PT Samtek Indonesia. I will be your moderator today alongside our outstanding speaker, Dr. Timur Taskesen, MD, PhD, Dermatologist. Before we begin, I would like to introduce our distinguished speaker for today's webinar. Dr. Timur Taskesen, MD, PhD, an esteemed medical professional with extensive experience in dermatology. Dr. Timur currently serves as the head doctor at Derma Aesthetics Healthcare. Prior to this, he held the role of chief physician at SkinMed AG Landsberg from October 2018 to March 2021, and previously led Palace Clinic Zurich as the head doctor. Apologies for any mispronunciation. He also brings significant international experience as a consultant in the Department of Dermatology and Allergology at Charité Berlin, one of the most prestigious medical institutions worldwide. Since 2009, Dr. Timur has actively worked as a resident in dermatology and venerology at Charité Berlin. With a strong educational background in medicine and biology from the University of Bonn and recognition as a specialist in dermatology and venerology, we're confident that Dr. Timur will provide valuable insights during today's discussion. Let's warmly welcome Dr. Timur Taskesen. Dr. Timur, the time is yours.
Thank you very much, and thank you for the kind introduction and the warm words. And I'm honestly very honored to be on the webinar today. So thank you for Swisscell, and also thank you for Somatech Indonesia for having me. And so I will just share my screen with you so I can start my presentation. So hopefully you can see my presentation. Today's talk will be about Cellbooster Lift, so also about what makes it different, and also to talk about the acne scar treatment with Cellbooster Lift. Some of you might remember me because I was at the launch of the Somatech Indonesia for Cellbooster in Jakarta, and it was a quite pleasant stay, and I have to say this was outstanding. So thank you again to Somatech Indonesia for having me, and also for this great venture. So who am I? So I think you know me, and by this kind introduction, you know what I did. And I'm a dermatologist, and I'm also an aesthetic physician working in my own clinic in Switzerland, Zurich. So Cellbooster Lift. I think you know about the cell boosters already, and I know that you use the products very widely, but what makes it so different? Well, as you might remember from my talk for the launch, it's the special shock technology that makes it so special. And the second thing about it is just like it's not a mesotherapy. So it's just like something that doesn't only provide a temporary solution, it works from the inside to improve the effects. So Cellbooster Lift is one of these therapeutic options that we have at our hands, which is kind of stimulating the skin from its inside. And so the cellular matrix gets a full rejuvenating and cure and care from within. So today's talk was aimed to talk about treating acne scars. So acne scars is something that is common in all of our people and in all of our people of color. It doesn't matter where we are. It doesn't matter what we do. Sometimes we cannot escape the acne and also not the scars that it might leave behind. So why is it so ideal for treating the scars? As I told you, Cellbooster Lift is something that works from within. So it kind of has an immediate skin effect by the hyaluronic acid which is inside, but it also kind of restructures the scaffold of the extracellular matrix. So it's activating the keratinocytes, it's activating the fibroblasts, and by this new collagen is formed, and you have other proteins which are just like for the skin redensification. So this is something that works perfectly fine with elderly skin, it works perfectly fine with young skin, but with acne scars, it's a special gift that we have at our hands that we can use. So as you can see with this text, it's a lot of text on one slide. And I know usually I try to avoid this, but this is something where it's really nice. So you have a hyaluronic acid to hydrate and plump it up. You have the amino acids and the vitamins who help to conquer the inflammation. And you have long-lasting results because it kind of activates the collagen production of our own skin. So, Cellbooster Lift, just a quick recap. You use it, it contains hyaluronic acid, it contains amino acids, it contains vitamins. So mainly it's just like a perfect composition in a way to boost your system and to help to kind of rejuvenate the skin from within. This is a slide you might also know from our presentation, but maybe you know it also from before and also from the materials Cell is providing to you. So you have the components here, and for example, you have the higher molecular weight HA, you have the vitamins inside, you have the amino acids inside, and these are just like essential for the build-up of our skin, and we can just kind of remodel the skin from within by giving it a little bit more of a structure, by bringing back the scaffold of our skin, and by this just also building it up. Then the cellular action, as I told you, is activating the keratinocytes and fibroblasts. So it's a kind of bioactivator. And by this, we have just like a new scaffold. We build up new collagen. And this is just like what we want and what we need. Everything plays together. So you have an antioxidant and also growth, anti-inflammatory stop in this. And so this is why it's so perfect. These protocols you might know, and today we're going to talk a little bit more about just going beyond these protocols, because it's really important to know what you can do with the product. So let's go back to acne. I've seen a lot of acne scars while I was in Indonesia, and the few days I spent there, I felt like this is a perfect product for here, and it's the perfect product for here in Switzerland or Germany or anywhere else in the world as well, because we all suffer of acne, and unfortunately we also develop acne scars. So there are different kind of types of scars, and you know it, and I know very professional, and you know about the scars of the acne. So type of scars in acne is just like 90% of the scars that we have are atrophic scars. So meaning that we have just ice pick scars, rolling scars, or box scars. And this is something where we have a loss of collagen. And so what to do about it? So, and you heard the slides before, we have something at our hands which can just kind of rebuild the collagen again. Then we have the post-inflammatory hyperpigmentation, and we have the post-inflammatory erythema, which is also something that we need to conquer. And as you might remember from the slide before, Cellbooster Lift has an anti-inflammatory and antioxidant capacity, and this is something that usually helps with here as well. So let's dive a little bit deeper into the scars that are usually most common in acne. So ice pick scars, box scars, and rolling scars. Here you get an understanding of the acne, how deep we are just in the skin, and we usually are either in the papillary or reticular dermis, depending a little bit also on the size of the scar. This is something which has definitely also a big effect on your self-esteem, because you can imagine that if you suffer of acne scars, most of the people are a little bit maybe emotionally instable and feel maybe not beautiful, even though you can try to hide it, you can do camouflage, makeup and everything, but I think in the end it's not a good choice to leave them as they are. So we can do something about them, and we have, as aesthetic doctors and dermatologists, we have such a variety of choice to use. So I'm going to talk about a little bit of the scar formation, because we have the sebaceous glands, which are usually the active the spot where we develop these scars. And by small occlusions of the hair follicle, the sebaceous glands cannot bring the sebum out, and so we develop like comedones, we develop whiteheads and blackheads, depending a little bit, just like if the skin is open or not. And then if the inflammation goes on, we develop a papular, a pustular, and then we develop sometimes cysts, the skin. And then because of the surrounding irritation and inflammation, we develop some kind of atrophic scars if the collagen is kind of reduced because of the inflammation, or sometimes we develop hypertrophic scars, which is definitely not that often, but sometimes it can happen, and this is something we need to avoid as well. But here we would need something different. If you should have any questions, please don't hesitate to put them in the Q&A section so that we can just talk about this. And I already knew that you would ask about the hypertrophic scars, and there we can do some mixture, which I can tell you what we can do about that. But sometimes we also need a little bit of a medical agent. So using, for example, triamcinolone inside of these mixtures with the scar to reduce also hypertrophic scars. So for atrophic scars, ice pick, box scar, rolling scars, as I told you, we can use the Cellbooster lift perfectly fine, and I will tell you some techniques about it. For the hypertrophic scars, if they are raised and also at certain points of our body, we need to kind of reduce this overactivity of the fibrocytes, and this is usually done by steroids. The second thing about the hypertrophic scars is sometimes they are cut out, so try to avoid that, because any kind of irritation in this area usually brings then more hypertrophic scars, and in the end you might even develop keloids. The third thing about the scars is usually the post-inflammatory hyperpigmentation, and sometimes also the erythema, and so you develop either red spots or dark spots rather than the true scars. So the treatment is a big variety of options that we have here. So we can use lasers. I love lasers, to be honest. They boost the collagen, they improve the fine lines, they improve the skin texture, and they also reduce the pigmentation. And this is something that is perfectly fine with a fractional laser if you have a skin type that is not so dark. The problem is just like if you have skin of color, because then the fractional laser might not be the go-to treatment option that we have at our hands. Then the vascular lasers like neodymium or maybe IPL, KTP, so different kind of options that we have there. BBL is also perfect, but the problem is that, again, if you're too tanned or if you have a darker skin type, it's not the best way to use it. And then we have microneedling, or we have peelings, which is a really good choice. But the problem is usually sometimes the microneedling can only do so much, and sometimes you have to go really deep inside of these atrophic scars to boost them. And this is something that might be a little bit problematic. And with the TCA, again, about the skin type, you have to think about that, or you can do a little bit of a less strong peelings than there. But this is also something that works perfectly fine. Retinoids is always a good choice as a dermatologist. I love that drug, and I'm happy that we can use it for a lot of skin issues. But again, it's just like something that where we need to know in which patient to use what. So let's go on. So if we want to address the scars, so what we can do. So, subcision is something that most of us do already when you place, for example, a filler in a deeper layer of the skin. So to kind of revolumize the collagen loss, or the volume loss that has been undergoing because of the aging process, because of loss of our fat pads, or sometimes also because of the scars that we want to get rid of. So I love to do the subcision as a minor surgical procedure, because sometimes you can use these no-core needles, which are just like a little bit more kind of traumatic, but you can also use a cannula. This is also fine. I would use a rigid cannula then for this, so at least maybe 22 gauge, and use a short one to to be able to control how you move it inside of the skin. And then you can be sure you can also kind of cut through these small bands, which are just like located then within the scar. And as you remember, as I told you, we have this kind of inflammative reaction around the cyst that is forming. And then by this, we have just also adhesions that are forming underneath. So this is something where we can use it just like that. But if you have the cannula at your hands, you can do something pretty fine, because you can just fill the syringe up with Cellbooster Lift, you put the cannula on top, and then you just go underneath the acne scar and kind of burst these fibrous tendons, which are just like underneath. And then you are just like able to provide direct solution by injecting then the Cellbooster Lift directly in the area where these sewered fibrous brands were. So we're talking about the mid-dermis. So this is really important to know where you are, because if you are too deep and you are in the subcutaneous fat tissue, you might lose a lot of product and don't have much of an effect. So think when you just like go inside of the skin, either if it's with a Nocor needle or if it's with the cannula, just always stay superficial. Directly under the epidermal layer, you should be able to at least know where you're guiding the cannula, but you should not see the cannula like in total. So this is really important to know your depth. And when you then inject the Cellbooster, it's really easy. And you sometimes, what I do is that I kind of layer what I want just like on top of it. So I start by using the technique like here. So I start by using the Cellbooster Lift with the acne scars in a primed cannula. And then I just sewer all these fibrous bands which are there. And then I inject the Cellbooster directly after in one session. The next session is then, if I do it, the second treatment option is then the CO2 laser directly after, because you have really, really nice results. If you cannot do it because of the skin types, then do another session of the Cellbooster Lift and another session of the Cellbooster Lift. So at least 3 to 6 sessions, and I would say at least maybe 2 to 3 weeks apart, and then you might have the best of results. I wouldn't limit myself by only using like 3 sessions for the acne scars and maybe not only one modality. So think about combining these things, and sometimes also you can do a technique like a dual layer technique. So you kind of inject the Cellbooster in the depth, and then you go epidermally or superficial dermally by micro injections and using fine needles, for example, because then you have also a brightness enhancing, you have enhancement of the tissue elasticity, and you also induce again elastin and collagen in a different kind of way than you would do it in the deep dermal layer, because then you are just using it in a different kind of type. So mixture of techniques is always something that is perfectly fine. And this is also what I like to do. So to combine and think what you can do about it. If you are not really trained with the cannula or even with a Nocor needle to go underneath the depressed scar, then use a needle, because you can use a needle for the injections anyway, and you can use even a fine needle in that area. Usually this is perfectly fine if you have a depressed scar. So if you have an atrophic scar, like an ice pick scar, for example, this is perfect for this, the needle method. So you go in and you just go directly into the scar, and then you start to go within the scar and around the scar, and you kind of loosen this tissue with a needle. But be aware that you don't go too deep, because here in the slide you can see it as well. If you would go too deep, you might have a small kind of bleeding, and sometimes also a bruise that might happen because of this. And once this kind of releasement has been done, because you sewer the fibrous bands which are underneath, you might already see that the skin is kind of coming upwards. And then what do? You have a needle at your hands, and you have a needle already primed with Cellbooster Lift. So inject it directly into that scar tissue, and you will know and you will see how you can elevate it, and it will just be a nice direct result. Sure, after a short term it might go back, but you will see the patient again in 2 weeks, and so you'll do that again and again and again, and you will see the ice pick and superficial boxcar scars will reduce. It will be a precise option for you to deliver a really nice result. And then if you are open, you can definitely do a peeling, you can do a laser, you can do microneedling, you can do microneedling radiofrequency. So think about combination. Don't do it in one session. So if you want to do it in one session, I would say start then by first the subcision, and then place the product underneath, and then you can do, for example, normal microneedling because you don't have any kind of heat that is delivered. As soon as you deliver heat, so radio frequency or laser, I would definitely divide 2 sessions out of each other, because you will then reduce the efficiency of the cell booster, and this is definitely just like something that you can avoid. So by the cannula method, I told you before, you can use it for larger areas. So usually for rolling scars. So just like at the cheeks where you have that, use the cannula, go underneath the skin, and then just try to go through these fibrous bands, sewer them. And as soon as they cut, you will see that these rolling scars will be a little bit less visible. And then you go and inject the cell booster shape in one go. This is perfect because you reduce the trauma. You have something at your hands which is already helping to kind of reduce the oxidative stress in the area. You will be activating the fibroblasts, and by this you will have a renewal of the cell metabolism, and by this also you have just like a really nice effect then inside of the skin. And by delivering HA in that area, and also the vitamins and the amino acids, you are just like definitely helping to build up the scaffold again, to hydrate the skin, and to bring the matrix into a structural integrity and better health. So this is really perfect. And if you have a patient who is maybe sensitive about the pain issue, this is the perfect thing to do. For example, here you can see it. Perfectly fine to use the subcision method, go underneath the skin, sewer these small untethered lines, and then you can just go and do more by using, for example, microneedling, by using microneedling radio frequency, by using laser resurfacing. So these are different kind of options that you can use just directly after. And this is how you boost your results, by using simple technical methods, and also adding then the cell booster inside of these train of thoughts, and then just also using the laser later on. And you will see really, really nice results. So again, because I like to do some things in different layers, and I like also to kind of have the medical understanding behind it, why we do it in what kind of layer. So the epidermal layer is something that is really just like where we want hydration, where we want to improve the skin tone, where we do it in a mesotherapy technique. So really, really superficial. And it helps to kind of activate the keratinocytes and brighten the skin tone, and it will just like smoothen the irregularities. But it's just still because the acne scars are deeper. So let's dive into the superficial dermal layer. So it's the papillary dermis. So what can we do there? We can use fine needles. As I told you before, you can go inside of these small scars and then just inject in the papillary dermis, really, really superficial, somehow just like maybe at around 3 to 4 millimeters depth. And this will help with the skin's firmness. So this is what the people just feel when they touch the skin, maybe a week after this kind of injection, then will they know, wow, this is perfectly fine because my skin tissue is firmer. And if we go deeper in the reticular, pick up where I left, so about the deep dermal layer. So we're in the reticular dermis, when we are really deep, we need to just go a little bit deeper for this. And we can use the needle. I wouldn't advise you to, because if you are that deep, the likelihood of injuring maybe small blood vessel and inducing a bruise is too high. So rather go for the cannula then. And then for the rolling scars, which are usually go-to scars with a needle, as I showed you before in the slide, with a young guy and also with a female patient, ruin in the big areas around the cheeks. So this is just like perfect to rebuild kind of dermal collagen and smoothen out these kind of things. So the next slide is a little bit just like a lot. So that's why I'm doing it a little bit just like bits by bits. This is the thing. So if we are thinking about how to use something that is easily done and which is effective for the patient, this is just like something where you can use the nice way to put it together. You will have an improvement of the skin hydration and the skin quality, because of the shock technology, because you have just like the stabilized amino acids and vitamins there. So you have a prolonged effect of the HA, but you also have a prolonged effect of the sequential release of the vitamins and amino acids, which is definitely different with other products on the market. It's minimal invasive, and you have a minimal downtime because it's well tolerated with patients. Well, sure, it's unpleasant if you just go inside of the skin, and sometimes it takes also a little bit of time. But even if you do dual layers, so if you do the cannula technique and then place Cellbooster on top, it's maximum half an hour, maybe 45 minutes, and then it's done. But the patient will be really happy with the results, and you have just like a precise stimulation of the collagen because you kind of inject it in different kind of layers, and by this you have a remodeling and you have an enhancement of the skin's firmness. And this is what the people are looking for. And so don't limit yourself by only doing it in one way. And if you want to do it in one way, do one time the cannula, next time the injection again, and then maybe bring in another device or maybe something else just to combine it. And the comprehensive approach behind is just like if you target both of the papillary and the reticular dermis, you have a technique of a holistic treatment. And this is what people love. So this is always, if I tell my patients I have a holistic option to do what I want to do and want to address, they love that. So it's really nice, and you need to know what you're doing. So rolling scars, cannula, superficial dermis. By this, you have a subcision. We talked about this. You already know about this. Ice pick scars. So go in with a needle. You need to go a little bit deeper because ice pick is also going, as the name says, really deep, but you have these kind of mini, small scars, and then inject directly into the base of the scar. And with the box scars, you can use the needle. You can also use the cannula. It's a little bit deeper, and it works fine with the filling and the smoothing out of the depressions in there. So again, combination, subcision, Cellbooster lift, perfectly fine for these atrophic scars and to lift up and just to fill the void. Combination of laser and Cellbooster is just like perfectly fine because this is what I do now, because here it's getting colder. Now we're in September and today's temperatures are really not that high anymore. And lucky you, in Asia, you still have a little bit of a warm autumn. This is not the case here in Switzerland. So laser treatments we do from September to March, and this is something that works perfectly fine also in combination with the Cellbooster. Microneedling radio frequency and the Cellbooster lift, perfectly good combination. Microneedling and Cellbooster lift in one session even. You go and inject the Cellbooster lift, or you put it in with the cannula, and then you do the microneedling on top. And if you want to do something that is energy based, then rather avoid the heat. So, this is something which is perfectly fine because this is something that works perfectly good, I think, also in darker skin types, but you have to be careful with the radio frequency and with the energy you apply on the skin. So, and this is something that definitely helps. And at this part, I would definitely also use then the Cellbooster. I would use it afterwards because I would let the skin cool down after this treatment, then use a Cellbooster lift later on, because then you have a kind of induction, like a double. And the second thing is just like you directly fill it, and you will have less trauma. You will have less time for the kind of regeneration, and so the patient will be happy about the results and will not have much of a downtime. And so this is just like, again, what I told you just like before, just like use the one thing and then directly inject it afterwards, after a cooling phase, and you will have a benefit of a more effective healing, and by overall also reduce downtime. Again, you can also use it before. I also do that, for example, for the Cellbooster lift and with a Cellbooster glow. I love the combination of the lasers. Either if it's young or if it's an older patient, it works perfectly fine. And you have a glow up combination, and you can sell these as nice packages, which I usually do to my patients. So, for example, here you can see the scars. You can see how the fractional laser removed the superficial layers of the skin and how the skin healed. And this is also a perfect thing. And what to do, and you can see here these open pores, you can see the rolling scars, and so this is only one part of how we can treat the scars. But before, we didn't have that much of a strong agent which we can use for scars in these type of things. So, for example, again, the injection techniques. So if you want to address also the fine lines, and you have these small scars, rolling scars, and you want to do it, just address them by injecting them a little bit differently, just like go maybe in a linear retrograde injection over the whole cheek part where you have that, if you are not doing it in a way just by using the cannula. Again, here, how to, for example, address also with the papular technique if you kind of feel unsafe with the injection technique of using the cannula. So you have small lines, and you can just go really superficial. You can do it perpendicular, but I would just definitely choose a little bit of an oblique angle, because then you are safe that you are not too deep, because where do you want to be? You want to be in the dermal layer to have also a better effect. And here, for example, you can also see a technique, just how I administer the Cellbooster Lift, for example, during treatments, and I use it also in the perioral frame area to reduce all these small fine lines around the mouth, around the eyes, and this is a perfect thing. And you can see I'm placing a lot of product in one area, and this is another vial, so don't be afraid also to use more product, because sometimes you need more product. And you can see how I just go within the lines, and then I administer that product, and you can see nicely how you have a nice effect and how you have a kind of direct lifting effect without using maybe another kind of injectable, and you will have nice results with it as well. As you might remember, and this is also something now we're coming towards the end of my presentation, is Cellbooster Lift is also something that shows a significant improvement, not only with the skin, but also with the skin microcirculation. And also it's also measured by patients and also by the injectors, and it's much improved, and you have a lot of improvement in there by the gaze scale. And also you have a very high satisfaction also from the not only from the injector side, but also from the side of the patients. So it's really something where you have a high satisfaction rate of the patients who underwent this treatment. And this is really important. So you have something at your hands which you can use really wisely. And it's really easy to inject. You know, it's kind of watery, it's a little fluid. You can just inject it really nicely. And as if you put it in these areas of concern, and also how I just showed it to you by the cannula and also by the needle technique, you will have definitely better results with it. And sometimes if you want to layer it and you want to use different kind of products in a different layer, then use this as well, and use the Cellbooster Lift, use the Cellbooster Shape, use the Cellbooster Glow. Because, you know, the special thing about the Cellbooster is the shot technology, the prolonged effect of its ingredients, and also just like the kind of induction of the collagen by kind of ticking different kind of boxes within our skin. So I'm coming to the end of my presentation. I thank you for your attention.
Thank you, Dr. Timur, for that remarkable presentation and the valuable insights shared. Now we will continue with the Q&A session. To all doctors, if you have any questions, feel free to type in the Q&A section. Dr. Timur, later I will read the questions for you, and then please answer the question. Untuk dokter semuanya, sekarang kita memasuki sesi tanya jawab. Jika dokter memiliki pertanyaan, dapat mengetik pertanyaannya di kolom Q&A. Okay, so the first question would be, is Cellbooster Lift used exclusively for atrophic scar? Can we use it for treating keloid scars, and how should it be treated?
So with the keloid scars, as I mentioned also during my presentation, it's a little bit more tricky, because you have a hypertrophy of the extracellular matrix, and you have more collagen buildup. So you kind of need to limit the activity of the fibrocytes, and you need to do this by using a steroid. You can also inject Cellbooster Lift in combination with a steroid inside of the hypertrophic scar. It's possible, because then you have a vehicle for the steroid to travel a little bit deeper, and you have a hydration, and you have an anti-inflammatory and antioxidant effect by the HA, which is inside of there, and also by the vitamins. So I would then maybe mix triamcinolone. In Germany or in Switzerland, it's called Kenacort, 10 milligrams for the face. It's usually in vial of a crystalline solution, and then 1 ml of this and 1 ml of the Cellbooster Lift. And then you have 2 ml, and then you can just also inject it into these kind of hypertrophic scars. But the less you irritate them, the better. So I wouldn't use a cannula going inside of a hypertrophic scar.
Okay, I will help to translate. Jadi untuk atrophic scar, kita bisa menggunakan steroid dicampur dengan Cellbooster Lift, karena dari Cellbooster Lift sendiri itu ada antioksidan, ada vitamin, kemudian juga ada hyaluronic acid. Ya, jadi cara untuk mencampurkannya adalah jika kita menggunakan triamcinolone 10 mg, kita ambil 1 mili triamcinolone 10 mg tersebut, kemudian ditambah 1 mili Cellbooster Lift, kemudian kita dapat injeksikan ke keloid tersebut. Tapi tidak digunakan kanula ya. Begitu, dokter-dokter. Okay, so the second question would be, for acne-prone skin with acne scars, is it possible to use Cellbooster with a cannula?
Well, yeah, you can, sure. You have to be a little bit more cautious about the skin because you need to optimize your entry point to not kind of go in where you have a kind of inflammation.
Kalau untuk yang acne scars dengan acne prone skin, jadi bisa, tapi hati-hati entry point-nya jangan di area yang inflamasi. The third question would be, which one is better for box scar using Cellbooster Lift? Is Cellbooster Lift as a standalone treatment with cannula, or combination Cellbooster Lift and CO2 laser, or combination Cellbooster Lift and RF microneedling?
Yeah, well, now maybe you heard me. I like the combination. So why limit yourself by only using one technique? So use whatever is also good for your patient. If the patient can afford the laser, do a combination, 1 session Cellbooster Lift, the next session the laser. If the patient cannot afford it, then do the subcision technique and use Cellbooster Lift only. Effects of microneedling RF or laser are somehow very, very close to each other.
Bisa dicampur tekniknya. Jadi kalau misalkan pasiennya memang bisa afford untuk satu sesi Cellbooster Lift, kemudian diselingi oleh satu sesi laser, kemudian dilanjutkan seperti itu. Kalau tidak, dapat dilakukan subsisi, kemudian dilakukan Cellbooster Lift. Jadi tergantung budget pasien ya, dokter-dokter. If the target is lifting, not scar, how many vials can we use in one patient?
Yeah, well, if you mean for the face, it's as you saw also on the video. I used 2 vials, so meaning 6 ml for 1/2 face. So it's just like 4 vials then for the full face treatment I did in the video.
Baik, jadi kalau untuk satu wajah bisa digunakan 4 vial. Nah, tadi yang di video tersebut adalah menggunakan 2 vial untuk setengah muka, jadi 6 mili ya dokter-dokter. Okay, and then so for the next question would be, how about mixing this product with polynucleotide to treat the scar?
You can. Sure. It's just like the effect of the polynucleotide is similar to the effect of the Cellbooster. So mixing it with it would be just like the only rational would be just like maybe you have an area of concern where you say, okay, I would like to do it more superficially and I want to address maybe the perioral or the periorbital area. Then I would understand using the polynucleotide. But for me, the effect of the polynucleotide is similar to the effect of the Cellbooster. So why mix 2 things that do the same?
Bisa, tetapi untuk PN sendiri itu kegunaannya mirip dengan Cellbooster. Jadi kecuali kalau misalkan kita memiliki area-area concern yang memang akan difokuskan, itu tidak perlu sih untuk dicampur. Tapi kalau misalkan di area sekitar mulut kita misalkan mau lebih fokus di area situ, dapat menggunakan CPN hanya di area situ saja, tetapi di area lain bisa dilakukan Cellbooster. This is the last question. Can we use the Cellbooster Lift for someone who has sunken eyes?
Yes, you can. Again, you have to know your depth. So if you have sunken eyes, you usually need more support with the volume because of the bone loss and because of the loss of fat, which is behind the eye. And if you give Cell Booster lift, you might densify the skin, but you will not have an effect on the sunken eye. So for this, you can, sure, but the limit is usually the amount in that area. So I would maybe definitely do a filler on the bone in this area, and then later on maybe do the Cell Booster shape for around the eye. That's a better choice.
Kalau untuk penggunaan cell booster lift untuk sunken eyes bisa, tetapi kita harus tahu kedalamannya. Biasanya karena jika pasien-pasien dengan sunken eyes biasanya membutuhkan volume. Nah, volume itu tidak bisa didapatkan hanya dari cell booster saja. Jadi lebih baik di filler on the bone, kemudian bisa dikombinasi dengan cell booster shape di area mata. Okay, that is the last question. After such an informative presentation and discussion, we have reached the end of today's event. Thank you once again to our exceptional speaker, Dr. Timur Taskesen. We have gained a wealth of valuable knowledge today. We also extend our gratitude to all the doctors for your time and active participation in this webinar. We hope it has been beneficial and enriched your knowledge. Regarding certificates, our team will share the link soon, so please stay tuned. Finally, I, Dr. Felisa, as today's moderator, thank you again for your presence and participation. We hope to see you at the next webinar. Stay healthy and see you next time. Terima kasih kepada semua dokter atas waktu dan partisipasinya dalam webinar ini. Semoga informasi yang disampaikan bermanfaat bagi kita semua. Untuk link sertifikat akan dikirimkan oleh tim kami. Sebagai penutup, saya Dr. Felisa selaku moderator mengucapkan terima kasih atas kehadiran dan partisipasi dokter-dokter. Sampai bertemu di lain kesempatan.